B syndrome, local points for acute shoulder joint pain. It cannot be overemphasized how important it is to choose the local points according to the involved channel, identified by checking for tenderness on pressure, and not according to preconceived ideas about certain points. For example, Li15 is certainly the most important local point for the shoulder joint, but if only the point TB14 is tender on pressure, then the latter should be used and not Li15. It is an extremely simple rule, but one that is frequently forgotten in practice. The local points for the shoulder joint. Distal acute would be stomach 38, GB 34, and bladder 58. For distal chronic, Li 4, 1 to 4, lung 7, TB 1 to 5, SI 1 to 3. An important local extra point is channeling, which is situated halfway between the acromioclavicular articulation and the anterior axillary fold. This point is very effective, and the main area of pain is in the front of the shoulder joint. The warming needle can be used since this type of pain and stiffness is usually caused by a combination of wind dampness and cold with the predominance of cold. So this is the location of the extra point channeling. The choice of local points needs to be guided not only by the involvement of the channels, but also by Western anatomical considerations. To understand this, we need to look at the anatomy of the joints involved in shoulder pain. There are three joints in the shoulder: the scapulohumeral joint, the acromioclavicular joint, and the sternoclavicular joint. The first two being the most important ones in shoulder pain. So this is the clavicle, the acromioclavicular joint, the acromion process, the coracoid process. This is the scapulohumeral joint. This is the humerus. The scapulohumeral joint is the shoulder joint proper. That is the one that connects the scapula to the arm. This is also the joint that is most involved in shoulder pain and limitation of movement of the arm. Furthermore, the abduction, flexion, and rotation of the arm are all under the control of the scapulohumeral muscles. It follows that to affect the scapulohumeral joint, it is important to treat the muscles overlying the scapula, hence the importance of the points situated over the scapula. That is SI 10, 11, 12, 13, and TB 15. In pain of the shoulder with limitation of movement, the best results are obtained if two or three of the previous points are needled with moxa on the needle and that needling only the points on the acromioclavicular joint, such as Li15 and TB14, is not enough. The reason for this is that the joint governing the movement of the arm is not the acromioclavicular joint, but the scapulohumeral one. Thank you for your attention.